Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Corynebacterium Diphtheria. So, Corynebacterium diphtheria is the cause of diphtheria, and this is rare in developed countries due to vaccination programs, including in the UK. However, outbreaks are still unfortunately common in areas with low vaccination rates or in crowded communities. There are understandably large regional variations due to factors such as healthcare infrastructure, availability of vaccines, and population-based factors such as overcrowding or crises such as wars. So, Corynebacterium diphtheria typically enters the body via the respiratory tract. Cutaneous infections can also occur, although this is rarer. Bacteria then adhere to epithelial cells in the upper respiratory tract or in skin wounds and grow and form colonies. These can then lead to the formation of pseudomembranes, which are a thick grey layer of dead cells, bacteria, and other substances, which can form on areas such as the tonsils, pharynx, or larynx. In terms of the pathophysiology, diphtheria toxin is responsible for the main symptoms of diphtheria, and this is an exotoxin that inhibits protein synthesis in the host cells, leading to cell death. The main symptoms of diphtheria include difficulty breathing and swallowing, and systemic dissemination of the toxin can be particularly dangerous. The toxin is cardiotoxic and neurotoxic, causing problems such as myocarditis, neuropathy, and if affecting the kidneys, also renal impairment. Diphtheria can also lead to the formation of skin ulcers, although this is less common. Prevention of diphtheria is key through vaccination with the diphtheria toxoid vaccine. The vaccine induces the production of antibodies against the diphtheria toxin, providing immunity. In terms of treatment, it's important to treat with penicillin, erythromycin or tetracyclines, and give antitoxin where cases of diphtheria are confirmed or probable. Supportive care is required for the effects of the toxin, and it's also important to immunise contacts. It's important to bear in mind as well that diphtheria is a notifiable disease in the UK. So let's now try a question. An 18-year-old male presents to the emergency department with a 48-hour history of a sore throat, fever, and hoarseness of voice. On examination, he appears unwell, with a barking cough and stridor. Inspection of the throat reveals a thick greyish-white membrane covering the tonsils and pharynx. He did not receive some of his vaccinations as a child. Which of the following is the most appropriate initial management for this patient? So these are our options. Firstly, administer a broad-spectrum antibiotic and schedule for urgent tonsillectomy. Second, immediate administration of diphtheria antitoxin and start benzyl penicillin. C, provide symptomatic treatment with paracetamol and observe for 24 hours. D, initiate oral corticosteroids. Or E, vaccination with diphtheria, tetanus and pertussis, or the DTP vaccine. So in this case, the correct answer, as you will recall from this presentation, is immediate administration of diphtheria antitoxin, because this is a probable or possibly even confirmed case at this point, and start benzyl penicillin. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.